Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we'll learn about dual special needs plans, heart health and obesity, and diabetes in children. All coming up next on Community Health Matters. Channel 5 Network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone. The last thing anyone needs who is very, very sick is a complicated process of getting help and getting the health care they need. My first guest is going to explain a system whereby they can get a lot of help. So good to see you. It's Dr. Barbara Nabrett-Stevens with UHC Community Health Plan of Tennessee, and you live and breathe this every day.
I do.
So tell us, what is dual special needs plan, the dual special needs plan?
Well, thank you, Amy. I'm so happy to be here.
Glad you're here.
The dual special needs plan, which is quite a mouthful, is a special Medicare Advantage plan for people who qualify for both Medicaid and Medicare. And if they do qualify for those two programs, they may qualify for the dual special needs program, which we call dee-snip.
That makes it easier. Yeah, sure.
dee-snip for short.
Okay, so let's give us a primer on Medicare, Medicaid. We just assume everybody knows what both are. Let's go over just briefly what they are.
Okay, fine. So Medicaid is a program that provides health benefits for people with low income. Medicare is a program that provides health benefits for people 65 years and older, or they can be younger than 65 if they have a disability that qualifies them for the program.
Then you've got Medicare Advantage. That's a supplemental program. Is that right or not really?
No, it is not supplemental.
Okay.
That's another type of Medicare program.
Gotcha.
Or plan. The Medicare Advantage plan is a product sponsored by a commercial health insurance company like United Healthcare that combines a person's Medicare benefits along with their Part D prescription coverage benefit into one, and it may offer additional benefits such as dental, hearing, or vision.
All right, so who would be eligible for the dee-snip, if you will, then?
Okay, so the dual program, or the dee-snip program, is a program for a person who has qualified for both Medicaid and Medicare, and who also has special medical needs and could take good advantage of help in navigating the healthcare system.
Maybe give us a profile of someone that would be one of your subscribers to this the dee-snip program. Sorry, who would be a patient that could really benefit from this? Who needs to know about it?
That's a really good question. So take, for example, a person who has disabilities and needs help with daily activities like bathing and dressing. Or it could be a person that has cognitive impairment or decreased ability to function mentally, or a mental condition, or somebody, and this is unfortunately a huge number of people that have a number of medical conditions and are seeing a number of doctors and really need help coordinating their care.
Coordinating, navigating, and probably a lot of these people are living with some type of caregiver. There's someone that is taking care of them, and they need to know about these programs too to help their loved one.
Oh yes, we live in a village. We need all the help we can get, and yes, one of the things we hope that this program will provide is information not only for the subscriber but for the family who may think that there may be something more that they can do and don't know where to turn to get that help. So this is a program that they certainly should consider.
Is this something rather new? Has this been around for a while?
It's been around for a while, actually, and there are, in 2017, there were 2 million people enrolled in the dee-snip program, and this represents about 3% of all of the people in Medicare.
My goodness. Are you talking about 2 million in Tennessee or around the country?
Around the country.
Around the country. All right, so obviously there was a need for this, and this program was created to take care of this population. So how do you make it simple for these folks who really need this?
Well, the reason that I said earlier that they should think about this in navigating the healthcare system is because by combining the benefits of both Medicaid and Medicare, you can help coordinate things better. And then we really encourage anyone involved in the care of a dee-snip member to work with everyone else so that there's coordination in the care and the member can have a simpler way of navigating the healthcare system and achieve a better quality of life.
That's what it's ultimately about.
Absolutely.
Because as you said, a lot of these people are pretty sick with numerous illnesses.
Numerous illnesses and needing additional help. I mean, they might not need someone, a skilled nurse, but they may just need a home health aide to come in and help them out in the home, fix meals, or they may need social services, they may need transportation. There are any number of things that you need to do that you don't miss until you don't have.
Sure.
In navigating the healthcare system.
Where do people apply? When can they apply? Are there certain times of the year? And where do they go to get signed up?
The good news is you can sign up for a dee-snip plan anytime, and you can switch plans anytime. Unlike the other Medicare programs, you're not locked into the Medicare enrollment period in the fall.
Fantastic. Okay.
Now, where? They have tried to make it as easy as possible to get information about the program. You can go online to find a plan at medicare.gov to see if there's a dee-snip program in your area. You can call an insurance counselor at the State Health Insurance Assistance Program to discuss the program.
Okay.
You can reach out to a licensed insurance agent, and they can either talk to you in person or over the phone to see if a dee-snip program is a good fit for you.
Okay.
And United Healthcare has people available to talk to you from 8 a.m. to 8 p.m. 7 days a week.
And I know you've got a phone number, or it's up on the screen. I see that.
1-844-588-5864.
There you go. Several different ways of reaching out and connecting with people, as you just saw and as you explained. Thank you so much for really giving us a nice tutorial on this program that could help so many people. Thank you, Dr. Stevens.
Thank you.
Good to see you. And we'll be right back after this.